This recent article was published, and before I break it down for you, I want to applaud everyone, at least in my comments, who has discussed this phenomena in detail. You guys have totally made me want to be a better provider. If you've ever left your healthcare provider's office feeling confused, ashamed, or unheard, chances are you are a victim of medical gaslighting. Medical gaslighting is a type of bias in the healthcare system. You're not believed, your symptoms are belittled, or you're simply not heard. This is a systemic issue. Over the past 100 years, the majority of funding has gone to the treatment of disease for cis white men, and how diseases all people suffer from affected those men. This simply creates gaps in how medical providers see and understand disease today. Heart disease is one of the best examples. As research has finally expanded across genders, we now recognize that a woman's symptoms of heart disease are very different than a man's. She doesn't fit into the typical algorithm of how someone would present with active heart disease. So when you combine these serious knowledge gaps with what is going on in the medical landscape today, you get an epidemic of medical gaslighting. Providers like myself are under a tremendous amount of pressure and time constraints to see as many patients as possible in a short period of time. Highest risk for medical gaslighting: women, people of color, the LGBTQ community, and the geriatric population. What are some signs that you might be the victim of medical gaslighting? Number 1, you're not being listened to or interrupted. Number 2, you have questions that simply go unanswered. Number 3, irrelevant mentions of your weight during an appointment. For women and people of color especially, they go to the doctor with a clear medical presentation and they get completely dismissed, and it is blamed on their weight. They are often told that their complaints are psychological or all in their head because they're out of shape or need to lose some weight. The article goes on to discuss tips to avoid medical gaslighting in your doctor's office. It's worth the read. It's in the skim. Check it out.